toddler has never been able to hear his own name until now. It's all thanks to the first of its kind bilateral ear gene therapy for people who were born with a specific type of inherited deafness. The treatment is helping children as young as 1, and the results? Remarkable.
When we ask questions, the child could respond. It's absolutely emotional. Everyone in tears.
Dr. Zhen Yichen with Mass Eye and Ear is leading the first of its kind clinical trials in China on children born deaf because of a mutation in what's called the otoferlin gene. This therapy works by injecting a dose of a specially designed virus which carries a healthy version of the gene into the cells in the inner ear, basically honing in on its target like any other infection. And just like that, it begins to restore function.
Is it immediately?
So it's really fast. Within 2 to 4 weeks, the children can start hearing the sound. They can speak. They can understand. They can listen to music and dance.
Dr. Chen says they're focusing on children in this trial, hoping for early intervention.
Normally, within 6 years, if they don't have any hearing input, normally their speech will be profoundly affected. They may not develop speech at all. If you look carefully, it's like a cochlea is like this.
I see. Back in the lab, Dr. Chen says there's still more research to be done, but says gene therapy really is paving the way for even more breakthroughs, such as treating vision loss.
My right eye, there's just no vision past that point.
Olivia Cook was born with Leber congenital amaurosis, or LCA, which is a rare type of inherited eye disorder that causes severe vision loss.
It was like any dim room, or when the sun starts to go down, I can't see anymore.
Olivia participated in another clinical trial at Mass Eye and Ear where doctors used a genetic editing tool called CRISPR to treat her left eye.
So the hope has been that if we could correct the underlying genetic cause of the disease, we could restore function.
Dr. Eric Pierce is director of the Ocular Genomics Institute at Mass Eye and Ear, and he says this is one of the first times they were able to use gene editing inside a patient's body.
We can't take the retina out, fix it, and put it back. So we need to do these therapeutic approaches in people's bodies. And we've shown that it's safe and that it appears to be working.
With my left eye now, I'm kind of seeing light perception right up over here and like down there. I can even see that my hands are wiggling around over there.
Olivia believes it's only the beginning.
If they were able to give me vision where I had never seen it before, I can't imagine what's going to come next.
It's amazing. Olivia was saying when I met her that she never understood what it meant when people would say, I see you at the corner out of my eye. Now she says she does thanks to this procedure, seeing things she's never been able to for the first time. She just feels more independent overall. And this is just the beginning. Doctors are continuing to research hundreds of genetic mutations to hopefully expand treatment to patients.
Wow, it is incredible.
It's amazing what science is doing now.
Yeah.
Oh,
and to see the little ones respond to the sound.
I know, for the first time. So amazing to see. Great work.